Let me ask you something most people never bring up at a medical appointment. When did your throat stop feeling clean? Not when you are sick, not during allergy season. On an ordinary morning, is there a persistent thickness sitting at the back of your throat, a coating that no amount of clearing seems to shift? If that sounds familiar, here is what I need you to know immediately. This is not in your head, and it is not simply a consequence of getting older. There are specific, identifiable reasons why this happens in people over 60, and most of them never come up during a standard appointment. My name is Dr. Emily Carter, the first spent more than 2 decades practicing internal medicine before transitioning to medical education. In all that time, one of the most consistently undertreated complaints I saw in older adults was exactly this: chronic throat mucus and that unrelenting urge to clear. Today I am going to give you 6 clinical reasons this happens. Explained in plain language, no fear, no filler. We will count down from reason 6 to reason 1. I have saved the most important cause for last. Stay with me. Reason 6. Indoor air quality heating vent, humidifier, person waking up and clearing throat. Reason number 6. Your indoor environment is disrupting your airways. Your entire respiratory tract is coated at all times in a thin layer of mucus. This is not illness, it is one of your body's primary defense systems. Under normal conditions, you never notice it. It clears silently. You are completely unaware of it. The disruption begins with dry air. Forced air heating in winter, central air conditioning in summer, both pull significant moisture from your indoor environment. When relative humidity drops below 30%, which is common in climate-controlled homes, your airways compensate by producing thicker mucus. Here is the age-specific problem. Tiny structures called cilia, which normally sweep mucus continuously out of your airway, become measurably less efficient after 60. Their movement slows, clearance takes longer. So the thicker mucus your body produces in dry air is not being moved away efficiently. It sits at the back of your throat. You feel it. The fix is direct. A cool mist humidifier in the bedroom, keeping humidity between 40 and 50% overnight, can produce noticeable improvement within 3 to 5 days. A small hygrometer lets you measure this accurately. Hydration matters equally. Mucus viscosity responds directly to how much water you drink. Many people over 60 are mildly dehydrated without realizing it. The thirst reflex becomes less reliable with age. 6 to 8 glasses of water daily is not arbitrary. It directly affects the consistency of your mucus. Segment 3, Reason 5, Silent acid reflux. Sun eating late at night, wedge pillow. Reason number 5, silent reflux. Acid reaching places heartburn does not. Most people associate acid reflux with chest burning. That form is real and common, but there is a second presentation far more common in adults over 60 that produces almost none of those classic symptoms. It is called laryngopharyngeal reflux, or LPR. Silent reflux. Here is the mechanism. The lower esophageal sphincter, the muscular valve between the stomach and esophagus, weakens with age. In standard reflux, acid enters the lower esophagus and produces heartburn. In LPR, the acid travels higher, all the way into the throat and larynx. The body's immediate response to acid contact with laryngeal tissue is to flood the area with protective mucus. That is the sensation, a persistent thickness at the back of the throat, frequently worst in the morning after hours of horizontal sleep during which acid has traveled most freely. The pattern is distinctive: morning hoarseness that clears within an hour of being upright, a mild cough after eating, chronic throat clearing that does not respond to allergy medication. These are LPR hallmarks. Practical steps: eat your last meal at least 3 hours before lying down. Elevate the head of your bed 15 to 30 degrees using a wedge pillow, not just extra pillows, which actually increase abdominal pressure. Common triggers include coffee, citrus, carbonated drinks, alcohol, and fatty meals. If you suspect this is part of your picture, it is worth raising with your physician. Evaluation is straightforward. Management options exist and work. Segment 4, Reason 4, Medication Side Effects Pill Organizer, Prescription Bottles, Doctor-Patient Conversation. Reason number 4, Prescription Medications that change mucus behavior. This is the reason that produces the strongest reaction when I explain it to patients, because it has been happening to them, sometimes for years, with no one ever making the connection. ACE inhibitors are among the most prescribed medications in adults over 60. You may know them as lisinopril, ramipril, or enalapril. They are effective blood pressure medications with strong evidence behind them. They also carry a well-documented side effect affecting 10 to 30% of patients: These drugs block an enzyme that normally breaks down a compound called bradykinin. When bradykinin accumulates, it irritates the mucous membranes of the airway. In some people, this produces a dry cough. In others, and this is the important point, it produces chronic throat mucus without any cough at all. Because the symptom builds gradually over months, almost no one connects it to the medication. The second category is first-generation antihistamines, the older compounds found in many sleep aids and cold formulations. These have strong anticholinergic activity that aggressively dries mucous membranes. When membranes dry out, the body overcorrects with thicker, harder-to-clear mucus. Using these regularly at night and then wondering why your throat is congested every morning, this is why. If your symptoms began or worsened around the time a prescription changed, bring that observation to your doctor. Equally effective alternatives exist. Substituting an ARB for an ACE inhibitor, for example, eliminates the bradykinin mechanism entirely. Do not stop any medication independently, but do ask the question directly. Mid-video engagement pause. Speak directly to camera, brief and warm. If this has already given you something useful to bring to your next appointment, that is exactly the goal. Type the word clarity in the comments if you are watching all the way through. It takes 3 seconds and genuinely helps me know this is landing. 3 more reasons. The final one is the most important. Let us keep going. Segment 5. Reason 3. Swallowing mechanics. Swallowing anatomy, animation, person drinking warm tea in morning. Reason number 3. Age-related changes in swallowing and postnasal drainage. Your nasal passages produce mucus continuously, not because of illness, but as a routine function of maintaining a moist, filtered airway. Normally, this drains silently down the back of your throat, and you swallow it without awareness. 2 things disrupt this baseline after 60. First, the mucus itself changes. The water content decreases. The protein concentration increases. The result is mucus that is more viscous, slower to drain, and prone to pooling at the back of the throat rather than flowing smoothly downward. Second, the swallowing mechanism changes. Swallowing involves more than 25 pairs of muscles and multiple cranial nerves working in precise coordination. Peer-reviewed studies using swallowing evaluations consistently show measurable slowing of the pharyngeal phase in adults between 60 and 70. Muscle contraction is less complete. Small amounts of mucus and liquid are left behind after each swallow rather than being fully cleared. These 2 changes together, thicker drainage and less complete swallowing, create exactly the accumulation people describe as a constantly full throat. There is a practical technique from swallowing rehabilitation that helps the effortful chin tuck swallow. Gently lower your chin a few degrees toward your chest and swallow with deliberate full effort. Repeat 2 to 3 times. This changes the geometry of the pharynx in a way that improves clearance. It is used clinically and has measurable evidence behind it. Contrast this with the reflexive throat clear, the brief forceful ahem. This does not efficiently clear mucus. What it does do is traumatize the vocal cords with each repetition, which stimulates more protective mucus production. It perpetuates the cycle rather than breaking it. Warm liquids in the morning, hot water, unsweetened herbal tea, transiently reduce mucus viscosity and ease morning accumulation. Simple, consistent, and evidence-supported. Segment 6. Reason 2. Dietary triggers. Dairy foods, food labels, colorful whole foods. Reason number 2, specific dietary triggers. I want to address the dairy question directly because there is both real science here and a great deal of mythology. Dairy does not directly increase mucus production in most people. Studies confirm this. However, lactose intolerance becomes significantly more common after 60 as intestinal enzyme production declines. In lactose-intolerant individuals, dairy consumption triggers gut inflammation that through immune signaling pathways can increase mucus production in the respiratory tract. It is an indirect mechanism, but it is clinically real for susceptible individuals. Beyond dairy, histamine-rich foods, aged cheeses, cured meats, fermented products, alcohol can trigger mast cell responses that directly stimulate mucus gland secretion in genetically susceptible people. Pay attention to the 30 to 60-minute window after specific meals. If your throat reliably thickens after certain foods, that pattern is clinical data. A systematic elimination trial, ideally guided by your physician, can identify your personal triggers with precision. Segment 7, Reason 1, Inflammation Cellular Illustration. Person walking outdoors, colorful vegetables, serious but hopeful tone, slower pace. Reason number 1, the most important reason on this list. Systemic chronic low-grade inflammation. Inflammation. Everything on this list exists in a biological context. And that context is reason number one. Inflammation is a term now central to geoscience, the science of biological aging. It describes a chronic, low-grade shift in immune system baseline activity that occurs as a predictable feature of normal aging. It is not a disease in the classical sense. It does not appear as an obvious abnormality on a standard blood panel, but it fundamentally changes how every tissue in your body, including your mucous membranes, responds to other stimuli. As the immune system ages, the proportion of senescent cells, cells that have reached the end of their functional lifespan but have not been cleared, increases. These cells continuously secrete low-level inflammatory signals. There is no acute threat to resolve. The signal simply persists. The mucous membranes of your throat, sinuses, and airways are immune-active tissue. When systemic inflammatory tone is chronically elevated, these membranes are chronically activated. They produce more mucus. The mucus is thicker. Sensitivity to every other factor on this list, dry air, trace acid, medication irritation, is substantially amplified. This is why inflammaging is number one. The same environmental trigger that produced a mild temporary response at 40 can produce a persistent, difficult-to-clear response at 65. The trigger has not changed. The systemic context has. What can be done? 3 levers with direct evidence. Diet. A pattern built around ultra-processed foods, refined carbohydrates, and excess sugar is consistently associated with elevated inflammatory markers. Conversely, long-chain omega-3 fatty acids from fatty fish, salmon, sardines, mackerel are precursors to compounds that actively support inflammation resolution. Deeply pigmented vegetables and fruits reduce oxidative load. Fermented foods support gut microbiome diversity, which is now understood to be a primary regulator of systemic inflammatory baseline. Sleep. During deep, slow-wave sleep, the body performs critical inflammatory regulation. Consistently sleeping under 7 hours, or sleeping with frequent arousals, is one of the most reproducible drivers of elevated inflammatory markers in older adults. Addressing sleep quality is not a comfort measure. It is immune system management. Movement. 30 to 45 minutes of moderate walking on most days produces direct, measurable reductions in circulating inflammatory cytokines. This is not primarily about cardiovascular fitness. It is about signaling to your immune system through sustained physical activity. Small, consistent improvements in these 3 areas produce real changes in inflammatory status over weeks to months. Changes that show up in exactly the kinds of persistent symptoms we have been discussing today. 6 reasons, each one grounded in clinical evidence, each one specific. Dry indoor air disrupting mucociliary clearance. Silent acid reflux triggering protective mucus at night. Medications altering mucus behavior through mechanisms no one explained. Natural changes in drainage and swallowing mechanics. Dietary triggers activating immune-mediated responses. And underlying all of it, inflammaging, the systemic context that makes every other factor hit harder. None of these are verdicts. They are a map. Review this list against your own daily life. 1 or 2 will resonate with specificity. Start there. Give it 3 consistent weeks of genuine attention. The biology is responsive. 1 clinical caution. If your symptoms include difficulty swallowing solids, blood and mucus, unexplained weight loss, or a progressive voice change, please seek evaluation promptly. Those symptoms require clinical assessment. For everyone else, you now have a framework most people living with this symptom have never been offered. If this was useful, share it with someone who would benefit from the explanation. That is what this channel is for. Take good care of your health. I will see you in the next video.